You're now listening to the Adiel Gorel Show. Each episode I'll bring you the latest news from my discussions with top health and wellness experts so that you can bring yourself into better health. Today on the Adiel Gorel Show.
Right. It's a challenge. We have a cat, and she used to be indoor outdoor. Now she's only indoor. But before we knew all about Lyme and all this other stuff, cats live a long time, you know? So.
Hi, everybody. It's a joy to be here again. Wonderful to be here. And we have an exciting interview that I think we can all learn a lot from and really be on the lookout for something that is lurking out there very near us and could really be a life changer, and not necessarily in a good way. So we are fortunate enough to be interviewing with Dr. Tom Moorcroft. Dr. Tom, thank you so much for being here today.
Yeah, thanks, Adiel. I'm so pleasure to be here. It's an honor, and I'm excited to have the conversation.
All right, so we're going to start from zero because we have viewers and listeners that we don't know exactly where they are. So why don't you tell us what Lyme disease is and how it presents in its acute versus the chronic stages, so we know the basics?
Yeah, I think it's an amazing place to start. And Lyme disease is a bacterial infection that we get if we're bitten by a deer tick that's infected with spirochete, so a type of bacteria that we call Borrelia burgdorferi. And that's the most common, cause of it. It's actually the number one vector-borne illness in America. So of all the things you can get from insects that bite and spiders and all other things that bite you and inject you with some sort of infection, this is number one. Most people think about Lyme disease as, you get this, what they call a bullseye rash. They're looking for those concentric rings coming out of a bite site, or like a swollen joint, specifically a swollen knee. So these are kind of the classic symptoms, and unfortunately, they're seen in very few people.
Oh, really?
Yeah. So the swollen knee is not too common. And the rash, depending upon who you read, if you talk to the CDC, the Center for Disease Control and Prevention, about 70% of people will get what they call erythema migrans rash. And if you look at the medical literature, though, it's more like 40 to 50% of people do. The issue with the rash is most of us are looking for a bullseye type of rash, but the bullseye rash is only about 20, maybe 30% of all these EM or erythema migrans rashes. So a lot of patients who are going to get a rash, it's just going to be like a red or purple blotch. So they're often missed because it's not that classic bullseye. So other symptoms that we look at are things like joint pain. And one of the things that's really important to think about is migratory joint pain. So if it moves from one joint to another joint to another joint, very commonly Lyme disease. And then fatigue and what a lot of us call brain fog, just where you can't think clearly. There's sort of our common symptoms. And if you've ever heard the term summer flu, if you have the flu in the middle of the summer and you're living in an area where Lyme is common, that's a kind of a flu-like illness with or without that rash. They're the kind of the most common acute symptoms.
So when you talk about the 40 to 50% of people that don't experience, you said the bullseye is for 20 or 30%, usually the rash in general is 40 to 50%, and you talked about a red and purple blotch.
Yeah.
What would the size of that blotch be?
Yeah, that's a great question. Usually to meet the criteria, they want it to be about 5 centimeters or more. But if I have a small rash that's the size of a quarter that was at a bite site from a tick, obviously I need to go see the doctor. But, if you were to even have a smaller one, a couple centimeters, you should have it checked out if it doesn't make sense. On my end, I've had Lyme and babesiosis in the past. to the point where I could barely even think, and I couldn't even read you something that was in front of me because I couldn't recognize it as as something that was to be read, to terrible fatigue and joint pain. I actually had a rash that covered most of my left arm and shoulder, half of my chest, down through my groin, and most of my left leg. And somehow the doctor actually accurately diagnosed that as Lyme disease, because that's not a typical rash either. That's like almost way too large. So the rash is variable. And then I got treated for a short period of time. That was about 10 days. And then I was sick for another 8 years with Lyme-like symptoms that everybody told me was sort of my head, and eventually told me I had chronic fatigue. But what it ended up turning out to be was I still had Lyme disease, and they had missed a diagnosis of babesiosis, which is a parasitic infection that infects your red blood cells like malaria, that comes from the exact same tick. So we find that not only can you get Lyme disease from that, but there are multiple other organisms that can cause acute illness from a deer tick bite as well.
That sounds very scary, I do have to say, but let's just start. We're still at that stage. We're going to ask a lot more questions, but
yeah,
that's the acute stage.
Mm-hmm.
What about if something has been missed and somebody goes around for a year? There was an article in the Wall Street Journal, and I heard an interview on NPR with the lady, I think it's the same lady, who talked about 15 years of suffering and going through all kinds of tests and starting to be afraid to seem like, a bad patient who is, a hypochondriac. And finally, when they diagnosed Lyme, she became a human being again, according to her. So can you talk about what it looks like 1 year down the road, 5 years down the road, when it hasn't gone diagnosed?
Yeah, I mean, if you get like from the sort of the conventional classical approach, you can have arthritis develop. You can get that swollen knee later on. There's cases of heart block, meaning where the top and the bottom of the heart don't work well together, and then you end up with like a temporary pacemaker or maybe permanent. You can develop things like a Bell's palsy, where you have like a drooping of one side of the face, looks like you had a stroke, but you're like 27 and you have a brand new stroke after going on a hiking trip 3 weeks or potentially 6 or 8 months ago. So you can have those kind of symptoms. A lot of times, and the people who, it sounds like this lady is someone that I'm familiar with as well, is that you get a tick bite that you may or may not know about, because many people don't even know. And just as a point of reference, about 95% of people who get Lyme get it from the nymph tick, which is one of the small baby ones, essentially. It's about the size of a poppy seed. So the adult deer tick is small, but you can see it. And it's the female transmits, so she's got a red-orange back end. But the nymph is so small, that's why people miss a lot. So that's important. And if you were to have not known you got bitten, you may or may not have had a transient rash. Then it's really common to, several years down the line, present with things like fibromyalgia. So you have diffuse muscle and joint pains. You may have numbness and tingling, executive function things, like you can't recall things. Your memory's not working as well. You could just have global brain fog. We see a lot of like executives will start to just lose their edge. And a lot of people will develop symptoms similar to depression, but it's like they sleep and they wake up not refreshed. Their libido goes down. They're not performing at work or at school as well. And then you go to the doctor over and over. Very commonly, we'll see people have been to 6, 8, 15 doctors before they get appropriately diagnosed. So they start to get depressed because they feel like crap and no one really has the right answer for them. So whenever I see somebody, that's one group of people. So we'll see people with like fibromyalgia, chronic fatigue type of things. You can see, like I said, the numbness and tingling and the cognitive. And then there's a subgroup of people that will also develop things like autoimmunity. So we have some evidence that things like multiple sclerosis and rheumatoid arthritis and even lupus may be triggered by Lyme disease. So you can have a syndrome that Lyme creates, it looks like that, but is not that, or you can have a genetic potential and Lyme kind of unleashes it and sort of puts some fuel on the fire. Lots of musculoskeletal, lots of cognitive stuff.
Well, I have to say that even so far, it sounds extremely scary. I think you are on the East Coast, are you?
Mm-hmm.
So, I mean, there are many, areas in the northern East Coast where I think there is a lot of, and I'm in California, and as I said, deer live in my front yard. Literally, they live in my front yard. The only reason they don't live in my backyard is because there's a fence. But I also live next to a mountain, and it's so beautiful. You can get out the door within 100 yards, you're already hiking on a beautiful mountain. Now, regarding those baby, the nymphs.
Yeah.
When my daughter goes on a hike, she comes back, she tells me, Dad, can you check my hair for ticks? Which is really quite excruciating because her hair is dark brown and long. So, excuse me, but if I choose to we choose to walk on the fire trails. We are on a fire trail. It's 15 feet wide.
Yep.
Yes, there are trees. Now, at some point, it gets narrower, and we get under some brush. Now, is that a danger? Could the tick, again, excuse my total lack of understanding, can the tick fall on your head or jump on your head from a branch of a tree?
Yeah. Excellent question. Ticks don't jump. They don't fly. If you bump something, they can fall on you. Typically, they're going to be in the lower brush. So think roughly waist high and below. They could be a little bit higher. But it's crazy. You can actually, they've clocked the tick. It can go from your big toe to the top of your head in less than a minute.
Oh.
So they typically don't, but they can move. And what's interesting is ticks love the edge. So Lyme is considered paradomestic, which kind of means it's estimated about 75% of people who get Lyme will get it in their yard or their friend's yard. And the reason being is all the areas where you think of mice and chipmunks loving to live on the edge between the woods and that trail or your lawn, those are the high risk areas. So if you think about your backyard and you take a swing set, a lot of people want to put their swing set in the back corner under the shade of the trees, but it's not that the tree you have to worry about, but it's that edge that you back your stuff into, because then you're in a tick habitat. Gardens are really great tick habitats. Deep in the woods are not great habitats for deer ticks. It's actually the fire trail is one of the highest risk places because you're close to the edge, and the ticks tend to live 10 feet into the woods and 10 feet out of the woods, give or take a little bit. They like to be protected from sun. So if you're in a bright, open, sunny area, that tends to desiccate them or dry them out. So that's an area that anytime you're really close to the edge there, you have to think about ticks, but we still have to go outside and have a good time,
No, but just to know what to watch out for. So the fire trail, which at least, to me until now, appeared safe. Maybe it's safer on a sunny day when the sun is bright and it's all in the sun. But you're saying the fire trail is actually the border. It's actually the edge.
Yeah, what's interesting, Adiel, is people ask me all the time, hey, I basically had Lyme and I didn't know and Babesia, I didn't know what it was for 8 years in a chronic state. And it took me another 4.5 years to get better. The good news is I've been better for over 11 years without any relapse. So the whole conversation of you can't get better is not true for everybody. But you can go outside and really prevent this, which would be the number one thing that all of us want you to do. Is there's a couple of really good tips that you can follow. And DEET is not all that good for Lyme disease or for preventing ticks from getting on you. Some of the herbal sprays help, but some of the things that are really good, you can get a spray called permethrin, and in a wet state, it's toxic to aquatic life, plants and animals. So don't be dumping any of this, in waterways. But if you spray it in like your garage or your, out on your driveway, and then you let the clothing dry, it kills ticks on contact, and it really prevents you from getting ticks on you. There was in the last couple of years, a study that showed you could decrease the amount of ticks on you by something like 70% if you only sprayed your shoes and your socks. So, because everybody wants you to, talks about, oh, put on the white stuff and tuck in your socks. I mean, like, I don't want to walk around looking like a beekeeper while I'm on a hike with my family, right? So, but if literally, so we took up, even before we read this, my daughter is 12. And when she goes to summer camps or just out on a hike with her friends, shoes and socks are always sprayed. We prefer to spray the rest of the stuff and let that dry, but that's the minimum. The other thing I tell people a lot is, how like sort of the boxer briefs and the sort of sporty compression shorts are all popular. They are great occlusive dressings for your groin because ticks love dark, warm places and a little moisture. So they like in between your toes, back of your knee. They love the groin. They love behind and in the ear and up in the hair and armpits stuff. They'll certainly bite other places. But if you put like some permethrin on your leg, on your socks and shoes, you wear some compression shorts or, like those boxer briefs, and now you have they can't get inside there in your groin. Now you've just got from your armpits up, really, there are high risk environments, and you can ask family members to help you with the ears and the hair. But at least now you've greatly decreased the likelihood that you're going to get a tick bite.
So let me expand that. Many people who stand all day are told by their doctor to wear the compression socks that go. So that would be effective in the same way.
Yeah, I mean, it would be. I don't know that you need it because they're not going to be able to burrow under the sock usually. They're kind of more like opportunists. But if you're wearing them, yeah, for sure, it'll definitely help. Same concept, though. The thing about the shorts is they don't have to be super tight. They just have to not be baggy, right? So anything that'll close it off, that's really good. And then the other thing is when you come home, you want to take your clothes off right away and either leave them outside, like in a bag in the garage or whatever, or go directly into the dryer. And so you have your outdoor clothes, they go in the dryer. If it's electric, it heats up a little quicker. If it's gas, you may have to go a little longer, but if it's electric, more like 5 or 10 minutes, closer to 20 minutes on high, if you have, if it's gas or whatever. But the nice thing is the idea is we want to kill the tick before it has a chance to come into the house. And I prefer to hop right in the shower and just take a quick rinse, because sometimes the ticks often will walk around for upwards of a day before they actually choose a site to attach to. So if you can get into the shower and, either have a hairbrush or one of those little scrubby things that you wrap around your finger to like go run through your hair, take your nice shower and then ask somebody from your family to check. It'll increase the likelihood that you're either going to find the tick or you're just going to get it off in the shower. And so that's another way to help you protect from actually getting this in the first place.
So that is a lot of learning here, because most people go on a hike, they come back home, maybe they take off the hiking shoes, but they will stay with the same clothes all the time, all day. They'll go into their bedroom. So that's very good to know. Can you spell that spray name, permethrin? I mean, can you?
Yeah, Permethrin, I believe is the correct spelling.
Permeti.
Yeah, Permethrin.
Okay, great. So
now,
that's very good to know for everyone.
Yeah, and that's something you can pick up on on some people's favorite online shopping area. It's called typically Sawyer's in a yellow bottle. A lot of the local hardware stores and or sporting goods stores will carry it for those like the fish and hunt. And it tells you not to get it on your skin, but I would prefer not to. But at the same time, there is a topical version of it that we use for the treatment of scabies that's like a 10 or 100-fold increase in the concentration of it. So it is relatively safe for people. Again, once it's dry, it's safe and non-toxic for everything except your tick and maybe some mosquitoes, which is sounds pretty good.
Okay, now let's talk about dogs. Let's say there's a person, the person behaves very carefully, very nicely, but they have a dog.
Yeah.
Now they hike on the mountain with the dog or on the trail. Oh, the dog just runs into the brush, they runs into the thing. So come home, I guess you want to look on your dog. But now with those nymphs, you might miss it altogether.
Right. It's tough. I mean, you know, there's a couple of different products out there that talk about being really good for ticks. I mean, Top Spot, which is fipronil, been around forever. The issue being the tick has to bite your dog or your cat, right? So it's already bitten the animal, but it will die. There's some newer ones like NexGard and Bravecto. I don't know how well they really work. For my animals, I mean, I don't like putting chemicals on them, but the Top Spot does work pretty well if I combine it with like a cedar oil spray. And again, I focus a lot on their feet and their legs, and for them, their underside. There are some different collars and stuff. There's nothing 100% out there right now, though, that does prevent that. And if you have indoor outdoor cats or you have dogs that are hiking, like you said, that is a risk for bringing them in your house. You just have to be extra careful, give them a good brush when they get home, but little harder to control in your dog than us.
It may be one of the things that you already mentioned, but I know that some people give their dogs some treatment once a month, and supposedly, Is that what you say? Is that one of the ones that you mentioned?
Yeah, so the Top Spot is the once a month topical, and then the other ones that like the NexGard and the Bravecto are the oral ones. You know, and a lot of them are combined to do other things to support your dog's health, and it depends on how all natural you want to be. I try to, you know, keep my dog super healthy and minimize the amount of medicines, but I think about it like, hey, I was on medicines for years and I don't take medicines. So in order to recover from all this Lyme and Babesia, I had to do so much treatment that if I can give myself or my dog a relatively non-toxic low dose of something in the high risk months, you know, it's a risk and benefit thing. Cause, you know, I know a lot of people who are listening are going to want to be like as natural as possible. And sometimes for our animals, we have to be a little less natural. Even permethrin, it's kind of natural, but not quite. So they're on the low end of the sort of toxic chemical perspective. But if you think about it, I mean, you're preventing an illness that it has so much disability associated with it. So it's kind of like a bit of a balance.
And not only that, I mean, the dog goes with your little girl. They come home, she goes to bed with the dog, she hugs the dog, and now the tick is on her from the dog. So
right. It's a challenge. We have a cat, and she used to be indoor outdoor. Now she's only indoor. But before we knew all about Lyme and all this other stuff, cats live a long time, you know? So we just thought it was cool. Yeah, exactly. You know, the one we have is almost 20. So it's like, you know, anyway, like, and our daughter sleeps with her, and we've always had like one or two dogs at the same time. We love an outdoor lifestyle. So we just make it a lifestyle of checking. And, you know, my daughter has gotten into the habit. She finishes skiing, she finishes hiking or riding her bike. Just like, I feel like I want to take a shower. And I don't know if that's because we influenced her, because we just come in from even kayaking and we go, I don't like to be sweaty and smelly at home. I like to exercise. So I get home, I hop in the shower quick, and then my wife does the same. And then we do the quick check. So it's nice when you're a parent, you can be a leader for your kids and really show them. And now like she'll do it even if we're like a little tired and we go to the couch for a minute. She's like, oh, I got to go take my shower.
Going back to the dogs and the oral medications, two of which you mentioned, are those effective?
I think they help somewhat. I mean, the biggest issue is most of them, with the exception maybe of like the cedar oil sprays, and it's questionable about how effective they are, but they're certainly nice. Is a lot of the medicines on the dog requires the tick to bite the dog and then it dies. So dogs have vaccines against Lyme. They're slightly better than the human one that we don't have right now because it didn't work well. Testing in dogs is generally felt to be better, and they actually use the spread of Lyme in dogs as a model for what to expect in human exposure, because their immune systems react more robustly to the testing, because ours don't. The testing is pretty miserable in people. So when you look at your dog, it's like if you're using the medicine and the tick bites the dog might get sick, but at least now the tick's dead. I don't know if dog lovers are going to like to hear that, but unfortunately, that's the best sort of option we have at the moment from that perspective.
Okay, so I mean, we can maybe help the dog from getting sick, but we can't really prevent that much the dog being a carrier of the tick into your home.
Right, and the only, like for us, we use the top spot, and the tick will die. We've pulled dead, engorged ticks, but they do have to feed a little bit. So the dog's at some risk. I will say, I know a bunch of people who have dogs who've gotten sick with Lyme or other deer tick infections. Our dogs who have been bitten, but had the top spot on them, they never got sick. And I haven't vaccinated them for Lyme just because it's questionable whether it works so hot. And that was just a personal decision. So, but at least at that point, the tick's no longer alive, but your dog is at risk, but we're at less risk.
So if you go to those vaccines, what's your general understanding of their effectiveness?
I'm not 100% clear in dogs. Because a lot of the people I see in my practice are the people who don't vaccinate for it or it failed. So I have a biased population of people, even in their dogs. But I know that in humans, we had a slightly effective vaccination, but it also triggered a lot of autoimmunity that looked like Lyme in about a third of people. So they took it off of the market for lack of consumer demand, but people didn't want it because they would get sick and we couldn't help them. People are working on various vaccines and other like once a year or twice a year pill. There's a lot of exciting research being done. I'm not going to hold my breath at the moment until we get further down the line. And the best bet is still prevention. But yeah, in humans, the vaccine hasn't worked all that great. So more to come on that. The dogs, I think it's all right. And it's better than, my understanding is it's better than a 50-50, which is pretty good. But
now, again, that's only when the tick bites the dog. Otherwise, it's not really, if the tick just lives on the dog.
Yeah, and that's the problem. If it walks on, you're right. If it just walking around and like it's walking on the dog going, where am I going to bite? And then you go give the dog a hug and then it goes on you. Yeah. Exactly.
Okay. So now let's go. I think we got a lot of great tips for safety. Now, if somebody has Lyme, I guess there are many stages, but let's talk about first the initial stage. Let's say somebody starts feeling bad right away, or they do have the rash or something. They know within a day or two, like our friend who kind of felt it almost right away and went straight to you. What is that treatment? What does that treatment look like?
Yeah, the acute stage, like you just described, is typically antibiotics. Doxycycline is sort of what we would call the drug of choice. It's not that it's superior for Lyme disease. It covers a lot of the other infections that also come in the same tick. So there are several other medicines that are effective. And even a lot of my friends are like naturopathic physicians or herbalists will refer out in an acute stage to make sure you get the antibiotics, because if we hit it early and long enough, we should be able to prevent the acute stage from being severe and hopefully minimize persistence of infection. So you can also start with herbs. There's no doubt about that. They can be effective, but as a physician who has the ability to prescribe both the medications and the herbs, I tend to do both because if we look at in Lyme disease, there's been this discussion of how long do we need to treat for? And the typical argument is 10 days or 14 days or maybe 21, with 21 being the long duration, right? The problem is we don't know what that number really is. We just assume it is because people start to feel better. And the issue became like we would treat people for, like me, for 10 days. And then 6 or 8 months later, you start having these bizarre symptoms and it's relapsing, right? So Lyme has a very long reproductive cycle, and it can be as long as every 21 days. So if you compare that to like strep that causes strep throat, it reproduces 30 to 40,000 times in 3 days.
Oh.
So we give that like 5 days of antibiotics and you're great, protects your heart, makes your strep throat go away. But when you look at the treatment for Lyme, if we look at reproductive cycle length, you'd have to treat somebody for something like 600 years or something to get the same ratio of treatment. So we're obviously not going to do that. If we look at the literature to help tell us how long do we treat somebody? We know in monkeys, at least, if we infect them for 4 months, we treat them with an intravenous antibiotic for 28 days and then do 2 months of that doxycycline after. We only cure 27% of them.
Oh, wow. That sounds very poor.
Abysmal.
Yes.
So,
really?
Yeah. And so the question is, what happens between day 0 and 4 months? And we haven't looked at that. So my thought, and the thought of a lot of people, is we want to treat people until their symptoms are gone and at least another like maybe 4 to 6 weeks. So we usually say, if you have acute Lyme disease, I want to treat you for probably 3 months at a minimum. That's assuming your symptoms go away quickly. Now, not everybody does that. And another option would be to treat you and monitor you. But I've seen too many people, Adiel, who they get Lyme, they get treated for 2 weeks or 3 weeks, and 3 months later, they're diagnosed with acute fibromyalgia. That's not even a real thing. You have to have unexplained symptoms for 6 months. I'm like, so.
That is not. I remember actually there is a doctor up here in Santa Rosa, and I knew a mother who had a daughter, a young lady of about 20, who had Lyme disease, and they were going to him. And part of his treatment was he would put them in a very, very hot environment. Like I said, is the sun in your face? Do you need to?
It's funny. It's just like it just started happening. I tried to close it right. I'm good if you're okay with it.
Yeah, no, I'm good. But I want you to be good.
Thank you.
So he puts them in a super hot, environment, so hot, and then he needs to make them recuperate from it. I think it goes to 106 even. So the idea is that it kills those, whatever the is it spirochete? I mean, what do you call those?
Yeah.
Spirochete. Okay. So does that work as a treatment?
I don't know that we have a lot of evidence behind that working in terms of like scientific studies, but certainly I know a lot of clinicians who do it. It's much more popular over in Europe where it's easier to do. The regulations are different, but yeah, hyperthermia is postulated for a lot of things. I think when you go back, there's so many adjunctive treatments, extra things you can do. But the bottom line is it's an infectious disease, and we should be treating it with antibiotics or at least antimicrobial herbs. And one of the reasons that it sticks around so much is the oldest known human infection is 5,300 plus years ago. And we found that spirochete in ticks that are preserved in amber that are over 13 million years old. And some of their cousins that lead to things like Rocky Mountain spotted fever, anaplasmosis, over 100 million years old.
Well, so that is longevity.
And they predate human beings, right? So they know how to reproduce slow and they know how to hide. And so while we don't have any known antibiotic resistance to Lyme, we have what they call persistence. So if we try to kill Lyme and some of these associated infections, they can switch their forms and hide. And they also go into places in the body where antibiotics can't get to and possibly the immune system can't get to. And so when all that happens, it just makes it harder to treat. And so there's been some really good research over the last 3 or 4 years looking at different treatments that might be effective. They've looked at antibiotics and essential oils. They've looked at herbs. And there are some herbals that have really started to shine in the treatment of Lyme disease, Babesia duncani, one of the species of Babesia, especially in California, that's common. And then also this infection called Bartonella, which, depending upon which researcher you argue with, comes from a tick or maybe comes from something else. But nonetheless, we find it in people with chronic Lyme often. We have to address it. So right now, many of us who do this as a specialty are combining sort of the best medication approaches with the best herbal approaches to get people better quicker than we did before. So it's really a promising time for anyone who may be experiencing chronic Lyme or other chronic tick-borne infections. So it's very different in the last couple of years than it was in the beginning of my career, which is really good.
Okay, so let's say that somebody comes to you and says, Dr. Tom, I've been feeling very weak and strange and brain foggy for 2 years. I got all the tests, they show nothing. You suspect Lyme. I assume there is a way to find out.
Mm-hmm.
So then you found out. They've been going at it for 2 years, for 3 years. They've been miserable. Now you found out. What would be the course of treatment at that point?
It kind of depends on the severity of symptoms and who you see. The way I was trained and the way I've started to morph my practice is we want to make sure your immune system has a strong foundation. And a quick touch point on some of the testing, why people aren't always positive. There's a window of time when antibodies may be positive, and over their natural history, they go up and down. But the other part is we're requiring your immune system to be fully functional. And when you look at me, like I have a congenital immunodeficiency and I take a treatment to bump it up. But if you have low immune system function, you may have low antibodies. The other thing is Lyme disease is known to turn off some of the processes within the lymph node that lead to your antibodies being formed. So a lot of the testing can be complicated. So we have to look at a clinical presentation. We have validated questionnaires that help you say, hey, I'm more likely or less likely to have Lyme disease. And then we do have some tests that can confirm it, or at least help point us in the right direction. So in a chronic state, 2 or 3 years, like you're saying, I generally will start people on things like detoxification and immune support, anti-inflammatories. We look at their diet to help kind of make sure there's nothing in there. We look at a lot of stress because stress is has a negative impact on our immune function. And any gut dysfunction, so many people, the tick-borne illnesses can mess up your gut, other things can mess up your gut. And when that happens, about 70% of your immune cells live there. So your immune system may not be working great, even if the blood work looks good. And then outside of that, it's a major organ of detoxification. So we want to just make sure that the channels out of the body are good. And one of the other parts is sleep is so critical for immune function, for memory, and especially we're learning in the last decade for brain detoxification and memory. So many of my people have, brain fog and executive function issues. So we're always looking at, are there ways to optimize that? And so we just talk about them. And some people you need to just go right into the next stage that I'll talk about. And the other ones you have to focus on getting more of a foundation. So it's individualized. From a treatment perspective, I generally start with the herbs and maybe some homeopathics to start sort of whittling away at the issue, because now it's like 3 or 4 years in, I feel like as long as I feel like I have a little time, I want to whittle away. And then we layer in our antibiotics as necessary. With that said, somebody might come in with something more severe, or their personal medical model doesn't align with using some of these other treatments. There are other very reasonable treatments, which would be starting with antibiotics and then maybe going to the herbals later. So I try to partner with people and meet them where they're at, so that as long as whatever treatments we agree on together are ones that make sense for them getting better.
So when you start with the antibiotics, whether it's right away or the secondary, when it was acute, you said 10, 14, or 21 days. What happens when it's not acute? How long?
Yeah. Yeah. And to be clear, like the standard of care is 10 to 21 days. For me, I typically treat a fair amount longer. Like I said, like, 2.5, 3 months, all other things being equal. In the chronic state, essentially we want to treat until your symptoms are gone and then some additional period of time to just make sure we didn't miss anything. And so that could be 4 or 6 months. That could be a couple of years. And I use the term, like if you were to come in and say, hey, I've been sick for 2.5 years, I have XYZ symptoms. I'm like, probably going to be 18 to 24 months of some form of treatment. And I use that term very carefully because I don't think that everybody needs open-ended antibiotics for years and years at a time. I know there are a few people that I've met who do, and maybe more than a few, but I think that we need to look at the body as a whole and figure out where the body's asking for help, catalyze that healing, get out of the way. So a lot of times that means antibiotics, say, for 6 or 8 months with some herbs. Then we stop the antibiotics and we just use herbs and some other things, as an example. But there's a lot of ways to do that.
That lady that had this big, they wrote about her in the Wall Street Journal just last weekend. And I think that's the one I heard about in NPR. I think she wrote a book about her experiences. So she discovered she had Lyme after 15 years. So would the treatment look a lot like what you described, or because of the length of time, it would be a little different?
Yeah, I think it looks a lot the same. I would probably say if it were 15 years of completely untreated, we'd probably have a project on our hands. So for me, I would even move a bit slower potentially. And I don't mean less effective or slower to get you to start to respond to treatment, but the longer someone's had it, the more likely it is it's really entrenched. And I don't want to just bang people over the head and cause all kinds of symptom flares without respecting where their body is. With that said, I've seen people 5 years of symptoms. We treat them for 2 months. They're completely asymptomatic. Treat them for 2 more months just to be safe and they're fine. But those people are uncommon. Like I look at major pieces. One, we want to look at what's the infectious load and what do we have? What infections are there? Can I treat that? I want to look at the immune system function. Many people with Lyme, Bartonella, even mold toxicity will have autoimmunity triggered. If there's autoimmunity, there are non-antibiotic, both medicine, peptide, even fish oil extract approaches to modulating the immune system. Because as we treat people and we kill these things, we can there's an inflammatory response. We can have a die-off or what people call a Herxheimer reaction. And that can be unpleasant. And sometimes we have to go through it, but sometimes we're just like, oh, we have a Herxheimer and it's like my badge of honor. Well, maybe it's too much for your system. So in the chronic state, we really want to make sure that we're focusing on the infections, we're focusing on immune function, and we're really supporting getting rid of some of the extra inflammation and toxicity, so detoxification as well.
So you mentioned the name Bartonella, a couple of times, and I would like to, understand just a little bit more. So, for example, I have a friend who said they had chronic fatigue, and they had it, and they healed from it. They were hiking and biking and feeling really strong, but they kind of felt it was lurking some. Well, I guess we can talk about what that comes from, maybe,
right.
The Epstein-Barr, whatever. But recently, that friend said, okay, it's come back, and now I got the Bartonella in my system. Oh, I didn't know much about it, but it seemed like it was an opportunistic bacteria that use the fact
right.
that they're weak. So can you talk a little bit about what that bacteria is?
Yeah, Bartonella is...
Stay tuned for part 2 of this interview. Thank you for joining us today. I know you love what's coming next in part 2. Be sure to click the subscribe button for more videos.